Welcome back, and today we're going to talk about carpal tunnel syndrome. So, as always, let's start with some basics. What exactly is the carpal tunnel? Well, the carpal tunnel is an area in the wrist. I'm not going to go through a detailed anatomy lesson, but in essence, the bottom of the carpal tunnel is made up by the bones of the wrist called the carpal bones. Over the top, we have a canopy, and that's made up by a piece of thick connective tissue called the flexor retinaculum. And running through the tunnel, we have a series of tendons that help move the fingers, and we have a nerve called the median nerve. Now, that nerve goes on to supply some parts of the hand. It supplies the muscles at the base of the thumb. We call these the thenar muscles, and it supplies sensation to a number of the fingers. It does not supply sensation to the little finger, and it only supplies half of the sensation to the ring finger. So the little finger side is not supplied by the median nerve, but you might have some of the sensation on the middle finger side supplied by the median nerve. The index finger and the middle finger the sensation is supplied by the median nerve. So what's the significance? Well, the carpal tunnel is kind of tracked all round as a fixed space. And if you develop swelling around that area, if the pressure inside that tunnel increases, then the nerve itself gets squashed. Nerves are quite sensitive. They do not like being squashed. And as a result, it can fire off improperly or stop firing altogether. If that happens, first thing you might notice is some discomfort or some pins and needles. So it's not uncommon when we go to sleep and we sleep on our arm, perhaps we've slept over the elbow. If you cause some pressure over the elbow, you might have caused compression of the ulnar nerve and you might get pins and needles. We may have all bumped our elbow at times and said, oh, I've hit my funny bone. That's the ulnar nerve, and you're getting shooting sensation down the arm where the ulnar nerve supplies the sensation. Sometimes when you're resting or you're sleeping, you may have been putting the wrist in a particularly unusual position, or perhaps you're sleeping on your arms, on your hands, putting pressure on that area. So you might wake up and feel that the fingers have gone numb. That can lead to other problems because first thing in the morning, you might feel like you're trying to shake the fingers to get them moving. You may find you're clumsy or dropping things when you wake up, and that's frustrating. But if that nerve is going on to become permanently pressurized, permanently affected, there may be some weakness of the muscles of the hand because they need the nerve supply to maintain their muscle mass. So you can get atrophy of those muscles if they're not properly innervated by the median nerve. Okay, so got a bit about what kind of symptoms you might get. That is tingling, shooting, pain, particularly index and middle finger. Often it might be worse first thing in the morning. We understand why the carpal tunnel is vulnerable to increases in pressure, but now we need to understand, well, why would that happen? What is the reason I would get an increase in pressure? Some of these are conditions of general health or just general changes in health, and some are related more specifically to rheumatological conditions. So if we are gaining weight suddenly, we've gained a lot of weight recently, obviously that is one thing that could cause increased pressure in the carpal tunnel. So increased weight, increased body mass is putting you at higher risk of carpal tunnel. It might be that you have a metabolic change, and sometimes that might also be causing the increase in your weight. For example, thyroid dysfunction can cause changes in pressure and water retention, and that can cause carpal tunnel and increased pressure in the carpal tunnel. So part of the workup for carpal tunnel would normally involve checking your thyroid function. Another metabolic condition that can cause carpal tunnel is diabetes. And so it would be sensible to check for diabetes. Diabetes is capable not only of causing carpal tunnel, but of causing other forms of nerve irritation, as the excess sugar effectively sugar coats the nerves and can lead to conditions called peripheral neuropathy, where the nerves start to become injured and fail to function properly, usually starting from the periphery, so from the fingertips and the toe tips, and moving its way backwards in what's called a glove and stocking distribution. Another thing that can change the pressure in your wrists, which is a temporary condition in women, is pregnancy. So you have a lot of changes in hormones and changes in water retention, and carpal tunnel is not uncommon during pregnancy. You can have certain activities that could put you at higher risk. We're often working on a computer, often using a mouse, and sometimes repetitive use or repetitive actions, the same action every single day, can cause a bit of micro trauma, a bit of swelling and irritation. And that comes on to how do we treat carpal tunnel once we've made a diagnosis. Okay, so the doctor's suspecting carpal tunnel. What might they do in the clinic room? There are two tests in terms of clinical examination that might help confirm their suspicions. One's called the Tinel test and the other one's called the Phelan's test. Tapping over the front of the wrist might cause the tingling sensation into those fingers, or increasing the pressure by flexing the hand against the forearm and keeping it there for long periods of time, typically doing both wrists at the same time, called the Phelan's test, may reproduce the symptoms. But to confirm this, alongside the tests for things like thyroid disease, diabetes, commonly we test for B vitamins, which can upset the nerves. A nerve conduction test is likely to be done where you pop some needles into the arm, into the forearm, and you zap the nerve, and you see how fast the nerve transmits information. You may also have an ultrasound of the wrist to look for any changes in the size of the nerve. The median nerve can actually enlarge after it's been squashed, and that can point towards an entrapment around the carpal tunnel. Okay, so now we know you've got carpal tunnel. We had the examination findings, we've done the bloods, we've done the scan, we've done the nerve conduction. What are we going to do to help you? The first thing is there anything in your lifestyle that can be changed? Are there ergonomics at work? Maybe we can change the mouse you're using. Perhaps there's some repetitive strain elements to this that might help. The second is this likely to be temporary? If you're getting carpal tunnel towards the end of pregnancy, it might not be necessary to rush in and make changes. If you've just been diagnosed with significant thyroid disturbance, perhaps once we treat your thyroid disease, things will improve. And how bad is the carpal tunnel? If it's very mild on the electrical test, you might not need any immediate interventions at this stage. However, if it's more moderate or severe, we do need to consider more significant intervention to prevent the nerves from being damaged in the longer term. What else could we do? We could try to protect the joint, so you can wear splints, particularly overnight. This prevents you from flexing the hand too much and causing too much pressure on the median nerve. Short term, you may be offered an injection into the wrist of a corticosteroid, and that is to help to reduce the swelling, but it can't be repeated multiple times. So the final option and definitive option for most is that the tissue over the top that we talked about, the flexor retinaculum, can be cut into by a surgeon, releasing the pressure. And this is the best option, particularly if you have moderate to severe carpal tunnel, in terms of improving your symptoms. So, in essence, if you're getting tingling or pins and needles or numbness in the fingers that happens first thing in the morning, it could be carpal tunnel. Testing you for things like diabetes, thyroid disease, making sure you're not pregnant, is important. Doing investigations related to the carpal tunnel is important to confirm that, and then interventions could be injections, splinting, or surgery. It's relevant to rheumatic diseases as well, which we've not really covered today, but as you can imagine, if there is swelling in the wrist area because of an active inflammatory arthritis, that too is going to increase the pressure around the wrist and increase the likelihood that you have that you have compression of the median nerve. So if you're experiencing pins and needles, as well as some of the more inflammatory sounding joint pains with your rheumatoid arthritis or psoriatic arthritis, then you may need to have some nerve tests to make sure you're not suffering from carpal tunnel syndrome in addition. I hope you found this helpful. Leave me a comment in the section below. And if you found the video useful, then feel free to share or like it, as it does help grow the visibility for the channel. Thank you.